So, this is the Perfect Storm workshop. Thank you everybody for coming. Overall, this specific presentation was put together by Dr. Tony Ebel over here. He teaches doctors across the nation, other chiropractors across the nation, specifically on the Perfect Storm. And I always like to kind of give a little bit of background on how this came about so that you can understand how we came to where we're at. So this is Oliver here. That was his son, or is his son. And he was born 6 weeks early. He had 3 different surgeries, every medication a kid could have. He had brain damage. He was told that there was a 20% chance of living to the age of 1. And if he did, he would have epilepsy, autism, cerebral palsy, and be stuck on all the medications for the rest of his life. He was getting adjustments, and throughout the process of his initial care in the hospital, and ended up actually leaving the NICU with a perfect MRI, even though he had a stroke and severe brain damage. He had a perfect EEG. He was off all the medications, never had a seizure of any challenges. So he then ultimately needed to know why, and dove really deep into kind of this world of kids on the spectrum with challenges, developmental delays, so on and so forth, and started to kind of find this trend that he labeled the Perfect Storm. So overall, as we are presenting to parents and other providers, we hear that everybody's just looking for answers, and ultimately with everything that's provided nowadays, it seems like they're coming up against really not knowing where to go. And when we're seeing these miraculous changes with nervous system focused chiropractic care, we need to be able to get that word out there. So that's what this Perfect Storm workshop is all about. And that's how I ended up with Justin Griffin and getting his amazing story, which you have a copy of his mom's testimonial there. But as we kind of go through, I'll also kind of show you what happened for him, and we'll get into it. So before we get into what the Perfect Storm is, I'm going to show you this little video.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13.
Did you get it?
But did you see the moonwalking bear?
I was looking for that.
Yeah.
So. I'm so proud of myself.
So I promise it was there on the first one. He comes in right here. And he's walking backwards. So the reason why I showed that to you is exactly what it says on the screen. It's extremely easy to miss something that you're not looking for. Majority of what we're doing as we're approaching these kids is we're not going deep enough into the understanding of how their system got to where it is. And in order for us to really help them as best as possible, we need to be able to understand, number one, their history, but then number two, the path that got them to where they're at. Because we need to be able to approach it in a specific order so that their system can then overcome what's going on. So when it comes to health, it is easy to miss something you're not looking for, and that's where the Perfect Storm comes in. So the Perfect Storm all starts in pregnancy. So ultimately, as we are developing, we are creating our neural pathways based off of what mom is producing in pregnancy. So when we have stress during pregnancy, the baby's going to start to hardwire and build those pathways in the brain to begin with. And the reason for that is because when baby's born, they need to be able to react to a stressful environment if it's a stressful environment. Okay? that makes sense. We all think of the umbilical cord as passing nutrients and chemicals. We cut down on drinking, we take prenatal vitamins, but you also have to think of it as the power cord as well. So it's also getting all the hormones from the mom. So stress hormones are going to then transfer through the umbilical cord to the baby as well. This is a survival mechanism, which is amazing, and it's great that it happens. But if you're not aware of it, and we don't approach it in a way that we have that understanding of, okay, if there's stress, we need to be able to maintain and understand how to allow the baby to then develop moving forward. That's where we need to start. So all the way back in the beginning, it can even be preconception. So you can see clinically documented, we found about 50% of the cases nationally with all the chiropractors that are doing this. There is some type of stress during pregnancy that kind of starts the cascade. The brain and the spinal cord are the first things to develop. So if it's always in a stress response, it's going to hardwire that into the system. That naturally ends up kind of running the show, because that's what your brain does. It runs the show. So then we move on to the second portion of the perfect storm, which is actually about 80 to 90% of the cases, specifically in autism and spectrum challenges, have some type of medical intervention during birth. So whether that's C-section, forceps, vacuum extraction, so on and so forth, induction, those are all creating a different reaction in the mom, and also creating stress on the baby. Now, that being said, when it's needed, it's life-saving. It is great to have, but at the same time, we just need to be able to know that this is happening so we can get out in front of it, right? One of the hardest things that I always run into is trying not to give blame in any way, because that's not the intent at all. But it's all about just being able to understand where it came from, so that we can actually transition and allow the patient or child to heal and shift. So when we're thinking about when we think a little bit deeper into the C-section, the forceps, the vacuum extraction, what is it that we are always told when we hold a baby? What are you supposed to do?
Support the head.
Support the head and neck. The vacuum extraction, the forceps, the C-section are all taking the neck, and number one, depending on what it is, they create axial traction. With the C-section itself, you actually get a lateral bending and a rotation as well. So it's all creating major stress at the very top of the spine, which is the conduit to the brain. So that automatically is going to force the baby into a sympathetic fight or flight reaction. That is the stress response. This then normally transitions into, we can move on to the next one. It transitions into colicky, stressed, constipated babies, specifically normally latching issues, troubles turning their head, so torticollis, plagiocephaly, cranial head shape, all can transition. But if you think about where all of the neurology that focuses on tongue, jaw, upper neck, it all emerges from this area, right? With the exception of the cranial nerves and all of that. But when you have that high stress in this area, it's going to create that irritation on those nerve roots and create those changes. So when we get into the stress colicky, constipated babies, they're normally not sleeping. A lot of arching will start to happen, crankiness, not eating very well. So it's kind of a cascade of the things that a baby needs to be able to do is eat, sleep, and poop. What are all three of those things What is needed for those three things to happen?
Relaxation.
You need to be able to relax. So if you're in a constant stress response, it's going to be much harder to perform those basic tasks, which also makes it that much harder to develop into the next stage, right? So when we're talking about the brain is going to focus on the primary functions first. If it cannot perform those functions, it's not going to move on to the next thing, right? And that's all because you need to be able to digest your food. You need to be able to fight off diseases that are coming at you. You need to be able to keep your heart beating, your lungs filling with air, right? So that is the primary function of babies, is to figure that out. Then they start to move on to more of the movement and so on and so forth. So then if you kind of think, if we're kind of future casting here, if you're not sleeping, you're not able to calm yourself, what does that turn into in 5th graders? ADHD. Trouble sitting still, trouble paying attention, just anxiety, all of that. So then we move on to the sensory constantly sick challenged toddler. So you start to notice missed milestones. You then are hitting motor and speech challenges. You start to see ear infections, respiratory illnesses as well. If, again, as we kind of come back to the upper neck, your lymph has to be able to drain down into the rest of your system. So when you have a major stress to the top of the neck, it's going to create a lot of tension and irritation in that space, and the ears have to be able to drain down into the stomach, ultimately. If you have an ear infection because there's a buildup in fluid and it's not draining, it's ultimately going to go to antibiotics or steroids. Antibiotics are, number one, they kill the gut, right? We all know you're supposed to focus on all of the bacteria in your gut. That is also where your parasympathetic hormones are absorbed, most of them. So dopamine and serotonin, 90% of that is absorbed in your gut, and those are your calming hormones. So if you go on the opposite side of that, which is steroids, that's actually a sympathetic stimulator. So it's forcing you, both of those, one decreasing the parasympathetics, the other one increasing the sympathetics, are just feeding back into that loop, right? So if you think about how you end up with a bug, it comes into your system, it's supposed to be caught by the mucosa and the lining in your nose, and that is then supposed to be shunted down into the adenoids and tonsils, down into the stomach to be destroyed. Right? When that cascade has an issue, it starts to, we kind of call it like the poor plumber, where it just backs up into the ears, and that's where you get the chronic ear infections. Then normally end up shifting into tubes, which drain it down into the tonsils and adenoids, end up seeing sore throats, constant illness. They remove the tonsils and adenoids, it shifts down into the lungs. The lungs are then forced into asthma, allergies, because it can't function because it has extra fluid in it, which then, on top of that, gut's destroyed because of the antibiotics. So if your gut's not working, you're not fighting off the disease, right? It's just this constant reaction that never allows the brain to function on in those primary areas. So I probably hit a bunch of those just by explaining that, but then it kind of moves on into the sensory spectrum, hyperactivity, emotionally stuck children, because they're not able to get past those primary functions. So their system isn't able to process 2 + 2 = 4 because they're trying to digest their food, or they're trying to drain their ears, right? And that's all happening because their system has been stuck in the sympathetic reaction because there's too much stress throughout their spine, which is the conduit to the brain, right? Let's see. When we're looking at specific diagnoses, it doesn't necessarily matter what the diagnosis is, because it really ends up being the neurology that's setting them up for whatever symptom, whatever diagnosis they're going to have, because that's their way of actually getting to where they're at, right? So this is going back to trying to figure out the full story. They're going to adapt and change based off of what their body and their brain is able to shift to. So when somebody shows up with severe anxiety, it's because that's their brain's ability to shift and change to get them through their experience. When someone shows up with autism, that was their way to shift and change to get them through their experience, right? Your brain is always constantly living off of the experience that it has. It is a fully sensory organ, right? Your brain is continuously taking in information from your environment. It doesn't matter what it is, physical, emotional, or chemical. Those sensory inputs to the brain then force it to react and respond to whatever's happening. And if the reaction and response is always a stress reaction, it's going to be harder for you to develop the proper pathways as you're kind of going through. Let's see. So once diagnosed with these spectrum challenges or developmental delays, hyperactivity, the biggest issue that we're seeing, and the reason why we need to have this presentation, is because the treatments themselves are too superficial. A lot of treatments, OT, PT, early intervention, it's all focused on a lot more kind of like the motor portion of the system. But as you'll see in just a bit, the motor happens after the autonomic nervous system is laid down. So if there is an imbalance to the autonomic nervous system, it's going to be a lot harder for those motor systems to be developed in the proper order and in the proper way, so that the system is functioning the way it's supposed to. So when you start with the therapies on the motor, there are times when it will actually sometimes make things worse, because the system itself, especially, if we're thinking about like retained primitive reflexes, those are protective mechanisms that the brain have in order to survive in the state that they're in. So when you start to kind of force those to be taken care of, if the brain isn't ready for it, you sometimes can see an exacerbation of whatever's happening because the brain's not ready for it, right? So it has to be that specific order in order for them to make the biggest leaps and bounds with their therapies, because it allows the system to develop in that specific hierarchy of healing, is what we call it. So when we move on, we can go even further. It ends up being exhausted, angry, anxious, depressed teenagers, and burnt out, stressed out, anxious, and ADHD adults. Does anybody have that going on? Right. It's amazing how many times I give this presentation and go, wait, that's me. So that ultimately is what the perfect storm is. When you think about the perfect storm, you can think of stress stuck on, right? And I kind of alluded to this earlier, but there's 3 different types of stress. There's, we call them the 3 T's: toxins, traumas, and thoughts. Every single reaction that you have with stress, it doesn't matter what it is, it's going to create a very similar pathway in your body. It's going to, because that's the way our brain knows how to deal with stress, right? When I first heard that, it kind of blew me away. It's obvious because we have to release stress hormones to react to stress that's coming in. But if you think of a car accident, and then you think of a bad relationship that you have, that ultimately creates the exact same reaction in your body. We just don't think about it that way, right? So as we go through our histories, we're always trying to understand where these stressors are coming in. It doesn't necessarily matter if it's an overwhelming, intense digestion problem or it's falling out of bed. Both of those are going to create specific symptoms and reactions in our body. It just depends on how our body adapts and changes to it. Depends on the diagnosis or the symptoms that are going to show up, right? So as we're kind of looking at it a little bit more, our brain takes in about 11 billion bits of information per second. Sorry, 11 million bits. Billion is pretty great. But we're conscious about 50 of them. So what that means is our subconscious is actually running the show. We are unable to understand what every single cell is doing in our body because we would not be able to function if we did. So that means the subconscious, if we put it into the two different portions of the nervous system, that is the autonomic portion of your nervous system. That's everything you do without thinking about it. That's breathing, heart rate, so on and so forth, right? So good neurology is what sets the stage. Good nutrition, better motor control, and development will come after that once the neurology actually is set in place. So we kind of talk about stress as something called a subluxation. So that's misalignment, fixation through the spine that actually decreases what's called proprioception. So that's your body's understanding of where you are in space based off of your joint and muscle movement. So if you close your eyes, you can take your finger, you can touch your nose. That's proprioception. That's because you're continuously getting that information and your brain is picking up on it so that you can continue those movements. When you have that decrease in that proprioception, you end up having stress stuck on in your system. It becomes even worse if you actually can't even tap into the parasympathetics though. So if we go back to the beginning, we go back to early stress with the birth intervention, majority of the time, specifically with more severe cases, we normally will see that the parasympathetic system actually hasn't even really developed. And that's because it's a use it or lose it principle. Your brain is continuously hardwiring and strengthening pathways that are continuously enforced. So if you don't ever get into a parasympathetic state, then it's that much harder for you to be able to deal with a loud noise or the tag on the back of your shirt or somebody yelling in the back of the classroom, right? You're not going to be able to deal with that extra input because you never really understood how to calm and relax your nervous system. So this is kind of the hierarchy of how the brain actually builds upon itself. So when we're looking at a subluxation, that is your altered perception, that proprioception in the brain. It changes the understanding that the brain has of that space. So when you have altered perception, you actually then ultimately have altered function. So we start, brain is built from the bottom up, back forward. So it receives information from the spinal cord, goes up into the brainstem, goes back into the cerebellum, which coordinates your behaviors and movements, and then goes forward into the prefrontal cortex. If there is a major stress on your system, the lower portions or the survival portions of your brain are going to take over and they're going to run the show because you need to run from the bear that's in front of you, right? So if that is a constant stress on your system, the prefrontal cortex has no chance of understanding things and interpreting things because it ultimately kind of shuts down. So as you can see, when the neuromotor portion of the system is altered, everything else is altered from there. So we have the autonomic portion of the nervous system that starts everything. So if you think about when a baby's born, what are they doing? They're literally laying there, understanding everything through their senses. They're moving, but they're not really rolling, they're not really crawling, they're not doing any of those major movements. They're just doing the basics. They're building that autonomic nervous system so that they can then move on to movement. Movement comes in, they start crawling, well, they start with rolling. They then start crawling, furniture cruising, standing up, running, doing all that. This then starts to add the gut and immune system in, because gut and immune system all function better when things are moving. Right? Your lymph has to drain. If you're not moving fully, those muscles that shunt the lymph aren't actually contracting fully the way that they're supposed to. It's going to be a lot harder for you to drain the lymph in your system. Same thing with your gut. Your gut works on movement. So the more movement that you can have, the more likely it is. I don't know if you've been around a constipated baby, but sometimes when you do just basic bicycle movements, that can get the movement going because it's actually stimulating and allowing the system to understand what's going on. It adds that proprioception in, right? So once the gut and immune system come online, then you can start to see speech start to show up. You can start to see social, behavioral, and emotional reactions actually engage. Because again, it's all about those basic functions first, and then you can move on to the higher functions in the brain. So the way you can kind of think about it is like too much tension equals a blown fuse. When the entire system is in fight or flight, the gut didn't get wrecked until the nervous system gets wrecked first. The immune system doesn't get weakened until the nervous system gets weakened first. All of that happens because the nervous system isn't understanding what's happening, so it's not actually reacting and responding the way that it's supposed to. So just to go through a few quick studies here. This was a Harvard study that was done specifically trying to understand how stress weakens the brain architecture. So you can see toxic stress weakens the architecture of the developing brain, which can lead to lifelong problems in learning, behavior, and physical and mental health. So the best thing about this study is they came up, number one, it showed two different nerves, one at normal, and then one with toxic stress placed on it. And you can see the normal has much more branches. And it also showed this human brain development graph. So you can see we have sensory pathways, so vision and hearing, which ultimately is your autonomic nervous system. Okay? Language then comes in, and higher cognitive function follows that. So if you think about, this is the first year of life here. The first 3 years of life, our brain develops faster than any other time in our life. We actually get more neurons in one day in the first 1 to 3 years of life than we do in a whole year as an adult. So this is laying the foundation. But if you think about this graph and you add chronic stress to the system, you can take this and just press it down, right? The systems aren't going to come online as fast as they should because there's too much stress on the nervous system, which isn't allowing them to develop the way that they're supposed to. So it's not necessarily, well, if we think about speech in general, speech is, just like the brain, it always works as a sensory input first. So you have to gain the information, then you process it in your brain, and then you have a behavioral output that is speech. Right? So everything that I just told you was because I was understanding the information coming in. I was then processing it and reacting and telling you. Right? So it's not necessarily as much of an output issue. It's more the input and coordination becomes scrambled and subluxated. That it forces the speech patterns not to develop the way that they're supposed to. So let's see. So the perfect storm algorithm is how much stress, those 3 T's, it's when did the stress occur, and how much care or how long to help restore the neurological balance. So this is, again, why we need to go into the history so deep, because we need to know those layers. Depending on where those layers come in, depends on how much their brain needs to heal and change with the proper input. Right? So I did give you this handout, and I think you've all seen it before. So this is it's called the Merrick chart, but it actually correlates specific areas of the spine to specific areas of the body. And ultimately, the spine, you can think of it as kind of like the superhighway of all of the information to and from the brain. When there is a subluxation, a decrease in the proprioception from a specific area of the spine, it's normally going to correlate with a specific sign or symptom because the brain is not perceiving that specific organ, that specific tissue, because you're not getting the input into the brain to see what's going on. The brain is really cool, and it actually creates a story based off of your past experiences. So if you're not getting proper input, it's going to base its reaction and response on what it knew before. So if you're digesting protein and it thinks you're digesting carbs, you're going to send the wrong input to digest the protein, and it's going to create irritable bowel syndrome, right? So if the brain can see what's going on, it's going to be able to react and respond better and faster and make changes that way. So subluxationstress.com. Can you tell? That's what I want you to know. So the 5 Ds of subluxation. We start with dyskinesia. So dyskinesia is a decrease in, there's an abnormal alignment and movement. Kinesia is Latin for movement. So 60% of all movement stimulation into the brain comes from the spine. And majority of it is the upper third, or the upper third of the neck is where most of that comes in. When you have no movement, so that's the kinesiology part, from the spine, you will seek movement in other ways. So you can't sit still, tap your feet, you chew. The other thing that we see is babies hitting their head against the wall. They're trying to adjust themselves. They're trying to add movement into that upper portion of their neck. Proprioception equals calming because the brain can see what's going on. So when you understand what's happening, your system can calm because you know what's going on. The next one ends up being disafferentation, which is an abnormal sensory input. Again, brain is a sensory organ. So when we have the wrong input into the brain, we're then going to show up with dysautonomia, which is an imbalance in the autonomic nervous system. So we kind of consider it like the gas and the brake. The gas is the sympathetics, the brake is the parasympathetic, which is the relaxation calming portion. When you're stuck in fight or flight and you don't have enough parasympathetic stimulation, you then start seeing dysfunction throughout the system. So you have an interference of optimal function in other key systems. Everything starts to break down, which then shows up with dyskinesis, which is abnormal energy expenditure and output. So this is where the behaviors and the reactions to abnormal perception start to show up. So this is the moonwalking bear. I'm going to skip this and just go to the picture. But you can see specifically there is a lot of stress and tension placed on the baby when this is happening. So it's easy to miss something you're not looking for. C-sections have increased significantly, unfortunately. When I say unfortunately, it's probably for the wrong reasons. We hope not, but sometimes that is true. It can be for a wrong reason. That being said, the more information that we can get out there to allow people to know that this can set up the perfect storm, is the goal, right? And that is, as C-sections and interventions and things continue to increase, we're going to continue to see these issues become more of an issue, more of a problem, because we're not taking care of it. The doctor who performs the C-section never follows the child, and that's really where the system's broken. Because if we were able to connect the two, you would actually see majority of cases, you'd be able to follow it. When a pediatrician gets the information that there was a C-section or a vacuum extraction, they look at it and they say it's normal. It's perfectly fine. It's common. But then you go down the cascade of everything we just talked about. And they normally tell you that they're going to grow out of it. And really it's just transitioning and growing into the next thing. So getting out in front of it is really where we want to go. The other thing that you can think about when you see this is if we look at stress during pregnancy that we've placed on pregnant moms. It continues to increase. We do more and more ultrasounds. We do, unfortunately, we've kind of created a system where we're seeing pregnancy as a disease, and that is in no way what we should be doing. It's an amazing, beautiful process, and we shouldn't be putting it into a sick care system, but that's what we know, so that's how we're doing it. So another study here showed somatic dysfunction is what osteopaths call subluxation. We just have a different word for it, but you can see in 99 out of 100 infants, at least one pattern of subluxation was found. And this was after a normal birth as well. So it doesn't necessarily have to be a crazy intervention that comes in. It can just be the regular push and pull of the natural process. So being able to check for it is what we should be doing. Right? Here's some more references. I'm not going to go through them, but if you'd like more info, feel free to ask. Just to kind of go a little bit deeper into the bottom up, back forward. Everything starts through the brainstem here. It then hits the cerebellum, which is, again, it's the coordination portion. It then moves forward into the amygdala and hippocampus. So as we kind of look at how dysautonomia sets itself up, forces the brain to kind of revert back to the survival mode. So the reptilian portion of the brain, which is the brainstem and that cerebellum. The amygdala then becomes stuck on, and this is where your emotional centers are. So this is why we normally get anxiety, fear reaction responses, withdrawal, overreactions. It's because we're living more in the amygdala portion of the brain. It's creating the emotional reaction. The hippocampus, when activated, well, you want it activated, but what you want it to be doing is storing memories in a positive way, where it's what's 2 + 2 = 4. But when you're in a fight or flight, constant stress response, it actually forces you to kind of create more tantrums and things like that, and you create a memory around it, right? Your memories, which this is another thing that blew my mind, but your memories are just sensory inputs that your brain remembers, right? Because if you actually think back to all of your memories, it's normally a smell or a taste or a vision that you've seen, and it's all kept in your brain, which is amazing. But, so this ultimately forces the prefrontal cortex, which is the executive functions, the great decision maker. It really stands no chance, and it reverts to the survival portion of the brain. So the brainstem to survival. So you can't be in growth and protection at the same time. This is a quote by Dr. Bruce Lipton. He's a stem cell biologist and epigenetic researcher. What this means is you cannot be in the sympathetic state and the parasympathetic state at the same time. it's impossible. You need to be able to go from one to the other and back again. And when our system is constantly in a fight or flight response, you can see gas versus brake here. It needs to be balanced. And the way to do that is focusing on the vagus nerve, because that's pretty cool. Vagus nerve is your biggest parasympathetic nerve in the body. It is also, don't quote me on this, I believe it's 80% afferent, which is actually sensory input into the brain, right? So the reason why I bring that up is because they did a study here that showed, they did an HRV, so that's a heart rate variability, which we do here in the office. And it actually, they did it on 3 different groups. The first one was kids that didn't have any struggles. The second one was in the middle. And the third were kids on the spectrum with severe challenges. They did a resting heart rate variability reading, and they found that the reading for the kids that were severely on the spectrum had a very low heart rate variability. What we want to see is a higher heart rate variability, because the more variable your heart rate is between each beat, the more likely it is that you can react and respond to stress. So when they then tested them, they did obstacle courses and tests and all kinds of more stressful reactions, which should technically increase the heart rate variability. For the kids on the severe side, they did not increase at all. So they stayed very low. And what that tells us is that their system as a whole struggles to actually modulate between that sympathetic and parasympathetic stimulation, which means that their autonomic nervous system, that underlying pillar, is not being taken care of. So this is one of Dr. Tony's patients, one of his first ones that he saw. And what this is showing, this is a thermal reading, which we also do in the office. The 2 areas of the spine, and you can see that on the chart that I gave you, that focus on the parasympathetic region, or it's the most highly parasympathetic regions of the body, are the vagus nerve at the top, and then the parasympathetic plexus at the sacrum. With the temperature reading here, you can see top and bottom are both jumping out, right? So what that's telling us is that irritation in his system is highly specific to the parasympathetic regions of the body, which means that he's not getting the proper input in those areas. This doesn't allow him to actually modulate and understand that parasympathetic balance that needs to happen. So this is before they started care. This is a little video of him getting in the car. You'll kind of see as they start moving that it becomes too much stimulation in the system, and he starts to overreact.
Kristen. See you later. Oh. No? Did you have fun? Did you have fun? Yes? Yes? You love Aunt Kristen?
So you can also kind of see it. He also has a bruise under his eye because he would hit his head a lot. Again, kind of going back to that baby hitting the wall.
Bye, Aunt Kristen.
Overall, the overstimulation is forcing him
We'll see
to
you later.
feel uncomfortable, right? So he's creating more of this reaction. His story, he was a forceps delivery. He was sick all the time. He had reactions to his shots, so they actually stopped after age 1 because he was overstimulated there. That's a different conversation. But if the autonomic nervous system isn't where it needs to be, you're not fighting off bugs, you're not digesting your food, and then you add a highly toxic chemical, it's a disease, into the system, it's going to be extremely difficult for your body to react and respond to the extra stimulation, which then ultimately could lead to other issues, right? So we're not going to go there, but overall, it's all about, again, those underlying things. So they stopped because they saw a change, right? He was constipated all the time. He never slept. He was the whole perfect storm. He was doing speech, OT, and PT. He was diagnosed at 3 for autism. The parents were told he was never going to walk and never was going to talk. You could see he was giving a little bit of feedback back and forth, but his entire nervous system was stuck in neurological storm. So that's the autism portion. So basically what's happening is he's not getting the perception that he needs. And when that happens, he's going to hit his head against things. He's going to try to stim, move. All of that is happening because they're trying to get the proprioception in the brain to actually understand that stress that's coming in. So as we move on, this was after they started in July, and this is September of that same month, or that same year. September of that same month. So just a few months, he ended up being more balanced. He was talking like crazy, singing a song, lost his diagnosis, and didn't need any more services.
What's that one? Cookie. What is it?
Cookie.
A dog?
Yes, yeah. And a fox.
What's that?
So you can see he's obviously more alert, right? He's able to actually hold a conversation with people. I mean, the other video didn't show you him trying to talk, but the reason why this happened so quickly
What's that one?
is because his system did what it knew it needed to do.
No, this one.
When the perception to the brain happens,
A snake.
when the perception to the brain happens the way that it's supposed to, it's going to heal itself. It's going to go through the steps of development that it wants to do and knows to do. It's just that when the system is in the way and you're not able to get the proper perception, you actually ultimately are hindering what's going on. So it all kind of goes back to just, again, the way the nervous system is perceiving what's going on. So this is Griffin. Kind of alluded to him a little bit earlier. I met Griffin when he was 3. He was diagnosed with epilepsy. And his seizures were rapidly becoming out of control. And it felt like we were just, this is his mom speaking, it felt like we were just throwing medications at him. All we were getting were side effects and no improvement in seizures. They had multiple neurology visits, lab work, tests, imaging. Nothing was identified the cause. Not to mention he was just continuing to get worse. So his mom was saying that she was hopeless, and we hear that a lot. Today, it's actually been much longer since I put this together, but Griffin is now, I believe, 2 years seizure-free. He's was on 4 medications. He's down to 1, and they're continuing to kind of back off of that as much as they can. These are his scans, and I know you can't see it extremely well, but the biggest thing that I want you to look at is this one here. You can see this black line is where he is. This was the first set that we did, and then this was as we kind of progressed through care. His energy was everywhere. You can see that he was really blown out in the lower portion of his body because there's this back and forth. And he was confused up here in his shoulders where he was pulling all to one side. He still had a little bit of that, but he calmed his system down. And you can actually see there's kind of like a big line right here through his mid-back. That's a pretty big adrenal area, T9, T10, which correlates to stress. That's where your stress hormones come from. So overall, his system was overwhelmed. You can see there's a lot of red on this, whereas not so much here. And it was very heavily one side to the other. So he wasn't coordinating both sides of his body the way that he needed to. And it was overstimulating his system. He had a lot of stress up top, but he was reacting down bottom. So what a seizure is you can think of it as almost like a reset, right? The brain has to reboot. So it goes into a seizure. His system was not coordinating the fact that the stress was up top and he was reacting down bottom. And as we started to organize that, number one, he started to put more energy up in the upper portion where you can see there's those red spots there. And he was calming it down. So he was able to kind of manage and understand what needed to happen so that he would stop seizing. As we move to the next one, this is anxiety. This is Anna. You also have Anna's testimonial there as well. She had severe anxiety at 7. She presented to our office not being able to leave home without having severe anxiety attacks. She had a history of ear infections, sore throats, balance and coordination problems, ADHD, and sensory issues. She was referred to us from another chiropractor, and now she is able to go to the movies without any issue. She dropped alternative support at school and never struggles to leave the house. And this, again, I mean, I can go through these all day, just the scans, but again, it was all about the coordination of the responses that she was getting. She had a lot of stress in her system, and it wasn't organized in a way that her body was actually reacting and responding the right way. She was completely shut down on the right side here, and she was actually a little bit out of balance as we were actually looking at the reaction there. And then she kind of correlated, all of her stress started to go up to the top. She started to react even bit more up at the top, right? So the biggest thing that we're always looking for is when there is stress on the system, are you actually reacting to it? Are you making changes the way that you're supposed to? If you're not, then you're going to kind of correlate things improperly. It's again, perception to the output. Perception, coordination, output. Perfect storm. I'm going to skip over that one. These are kind of the categories, but you can see. If you know kids that are a little more uncoordinated, a lot of the times they will actually have a really weak core, and that will show up in exhaustion through the system here. Whereas if you know somebody that has ADHD, bouncing off the walls, it's going to be very high throughout the system. Then you can also put it all together, and that's normally where we see major spectrum challenges and diagnoses. So let's see. Finish off on this fun quote by Bruce Lipton again. So the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. So if we look at it a little bit deeper, the challenge that we have is that the nervous system itself is not perceiving what's happening. So when you have perception of the environment that is not exactly what the environment is telling the brain, it's then going to coordinate the behavior of every single cell to be improperly reacted to, right? Because you're not getting the proper input. Any questions? Yes.
So with Anna, who had severe anxiety,
Yeah.
how long was her treatment, and did she need the maintenance treatment after it, and how old was she? She looked between age, so.
So for the video, the question was, how long did Anna need care for? And then did she need maintenance care following that? She was on a 48 visit plan. So we did 3 times a week for 12 weeks and then dropped it down to 2 times a week for 6. And then she has been continuing some maintenance care. And that is totally up to the family, depending on what they're looking for. But we have noticed that if she goes longer than a month, then things start to kind of creep back.
Okay.
So they've decided, I think she comes every other week, just to make sure that
Yes.
she's getting the proper perception and
That's
input.
great.
And then Griffin, I believe, was 72 visits. It's either 60 or 72. With seizures, it's
Yeah, it's
obviously,
more
yeah.
complex, I imagine.
So the most important aspect of how the brain heals is input. You need to have consistency in order for the brain to change. If you only have a few adjustments here and there, the brain is seeing it, it's understanding it, but if we go back to when I was talking about the sympathetics being hardwired, what you use is what you're going to strengthen. So if you're not getting the input or the change into the brain, you're not going to, number one, if you don't have the parasympathetic portion, which is, again, it's the worst part, you won't create those pathways. You have to be able to continuously add input to allow the brain to see what's going on. And then once it can see what's going on, you can start to back off of it as long as the system is moving in the right direction, right? So we kind of get into a give and take, and we do scans every 12 visits,
Yes.
so that we can actually make sure that, number one, we're adding the right input, but then number two, if they're ready to back off, we can back off. But we also don't want to do it too early. It's kind of a fun dance that we have to go through, because if we back off too early, maybe they didn't get enough input and they can start to regress. So, yeah. Great question. Okay. Any other questions? Perfect. Thank you, everybody, for coming.